Okay, we are back. I am back with the amazing Lori Fleming, co-founder of The Womb, doula of several decades, and my personal doula for both babies. And today we are going to dive into the hot topic of birth plans, because a lot of people have a lot of opinions about the efficacy or point of birth plans. How do you have a birth plan when you can't plan something like birth? Things are going
Yeah.
to pop up, right? That you can't necessarily plan. And there were even like letters. There was a viral letter a couple of years ago circulating from, OBs saying like, we don't want to see your birth plan. Like we're done with the birth plans because it can feel, I think, a lot of the times for providers like a list of demands. And so we want to clear this all up. Let's talk about the purpose of a birth plan, what it really is, what should it really be considered as. Lori, take it away.
Thank you, Nikki. Yeah, when I first started as a doula, I was first, well, even before I was using the word doula, because I didn't know what a doula was when I was first a doula. In 1997, I was just birth coaching many clients, and that came with talking to them about preparing them for their birth. And it wasn't necessarily a birth plan. We just talked about what all the options are, that we knew and what we felt right. So then that turned into having a company called Halton Doula Group that we started in 2007, which I think was one of the first doula collectives, certainly in our area. And we started working on birth plans with people. And, that's what we knew, and that's what we did. And I still intend that was a great tool and a great thing to have. And the very first thing on all the birth plans was a thank you to the team, to like, thank you for working with us, for being on our team, that we're working together towards a positive birth experience. And that is, and obviously the goal being healthy, mom, birthing person and baby, but it's not all that's important. And so we used it as a tool. And yeah, the word birth plan, I can understand why to some healthcare providers, or some, in some cases it can be negative for sure, that your people are coming in with a prescribed step 1, step 2, do this, do that. This is what I want. This is what I don't want. This is how it's going to go, which we cannot control birth, and we're not meant to control birth, but we can certainly influence the process. And my career as a doula, it's about how we influence the process and how we can go through that. And when people have it at least prenatally discuss the options and have some really good childbirth preparation, they can use that information to develop not a step-by-step plan, but more a guideline on going through at least the exercise of what's important and what's not important to you, and what you need more information on, and what you want to how you want to steer the ship, right? If you don't have a roadmap of any kind, then you might get there, but you're not going to get there. Either you won't get to the exact destination, or you won't get to, you might be going backwards. And it's not to say that if you have a roadmap that this is the exact course, but when you deviate from the course, at least you have a North Star and you have kind of guidelines that you're working. And you also use it as a communication tool, so that whomever is on your birthing team, is that you really are using it as as a communication tool to know, this is who I am. This is what feels right to me. This is what's important. And you're all there for together, and you're there for whomever is with you is there for you.
Mm-hmm. Yeah, totally. It's funny. I think of it as almost like an if-then diagram. Like if this happens, then this will, like to help you kind of run through scenarios in a productive way ahead of the time. So when I had a home birth and then I ended up having the meconium, and the midwives were like, yeah, so we need to abandon this plan. And it was like, I'm 8 centimeters dilated. We got to do something. We got to do something fast. And I had run through it in my head. I'm like, if this doesn't work out for whatever reason, and I need to transfer the hospital, who's going to be with the baby? Who's going to, like, because I had a toddler at the time. Which hospital am I going to? Who's going to drive? Like, who's going to come? It was COVID. Who's going to come into because you could only have one support person. So, spoiler alert, I chose you, Lori. But like all of that was part of this sort of scenarios that I had kind of run through in my head. Was it my first choice? No, it wasn't, but I was able to make those quick decisions in a moment of some urgency, and it didn't at all feel traumatic because I had sort of mentally, I guess, prepared in some way. So I think that there's also that component where you're sort of like, you're not married to it. I think I've gotten a lot of kickback or pushback, I should say, on birth plans where people are like, what's the point? Now a lot of people have said to me, I had a birth plan and it didn't go according to plan and it set me up for disappointment. So
Mm,
I think we need to clarify that. And of course, that's not the goal of a birth
right.
plan.
No, exactly. Yeah, it's not to have the step-by-step process. It's a communication tool. It's used to get the information that you need so that when you are faced with a decision that you've gone through the brain, we talked about that, the benefits, risk, alternatives, intuitive and nothing, but you also have, oh, my apologies. Um, you also have gone through the exercise of putting together, if you, in the case of, I for sure want to have an epidural, 100% I want an epidural. You need to go through like what happens if you have a precipitous, really fast labor and your baby beats the anesthesiologist,
Hmm.
right? It's not, and I did have that probably funny story and too long for this, but short version of it is I had a client I was with, many clients who happened to be Croatian, and a lovely lady called me and she said, listen, you've been a doula for every single one of my friends who's had a baby. And they all ended up, because it was important to them to have unmedicated process, that none of them had an epidural. I'm just telling you right now, I want an epidural, 100%. And I said, awesome, perfect. I will help you use your voice when it's time to ask for that and to be so. Um, what ended up happening is that she was in the hospital and literally went from 2 centimeters to 10 centimeters dilated so fast that the baby beat the anesthesiologist. And it was funny because her only other wish was that I suggest often that it's the partner that or the person birthing that says it's a, especially when they don't know if it's a boy or girl, that they announce it themselves versus your healthcare provider saying it. I feel like it's makes it a more personal experience. So in this case, her husband wanted to say it's a boy or it's a girl, and because it happened so quickly, he was standing beside me, and so um, I said, "Your baby is coming right now." And she said, "Awesome." I said, "You, what an amazing job you've done. Here comes your baby." And she had such a fast, even second stage of labor with pushing that the baby came out, and I looked at her partner, and he wasn't saying anything. And so I said, it's really slowly. And I could see the white of his eyes, and I had to grab the strings on his hoodie, and he was going down at the time, and I had to hold on to him. I know you can't see what I'm doing right now, but I literally had to gently place him down, and I had to say to the healthcare providers, dad down, dad down,
Oh
dad
my
down.
God.
And by the way, it's a girl.
Oh my God. Oh gosh.
See, sometimes don't things don't go exactly
Yeah.
as you plan, right? And like we talked about at the beginning, it's more about how do you, well, one, you influence the process by what's going on in your head a lot more than we think we do. So we can't control birth, but the process is definitely influenced by what you're thinking and how you're preparing for birth. And I know your classes and certainly our classes at the womb too do definitely go into that a lot. So
Yeah. Oh my gosh. There's so much around that. I was given advice recently on a podcast that I want to share. I interviewed an amazing OB here in Toronto, and she basically is all about trauma informed care. And so we had a
mhm.
really powerful conversation. And she was talking about suggestions for patients around creating birth plans. And her suggestion was that you essentially write a cover letter, not long, but like a paragraph saying before you hand them the sheet with the check marks of delayed cord clamping and I want an epidural, I don't want an epidural, like all these types of cervical checks, yes, no, all that. It was really around like humanizing it to say, for example, if you are someone who maybe this is your second baby and maybe you had some more severe tearing the first time around and your biggest fear is tearing, that you write that down and you say, you know what, this is my second baby. I sustained, for example, a third-degree tear the first time. It was a really rough recovery. My biggest fear, so whatever you can do to support me around protecting my perineum would be my biggest, So you're sort
I
of,
love it.
right, saying that, and instead of not saying that, and that way it's sort of like it gets people more on your side, and it's less about feeling like as a provider you're just given this list and a list of demands. You're like, oh, this patient of mine's like really anxious around tearing. Let me see whatever I can do to support her. And it sort of makes it a more of collaborative, humanized process. That was the OB's suggestion, and I thought it was a really
Totally. And just to clarify, that is what I have done with clients. So I take that when I say checklist, like a birth options checklist, that's a communication tool for me to use with our clients. And for, at the womb is that we go through and kind of discuss all these things. You don't take a 4 or 5 page document to your birth and give it to anybody. It is always framed in that in a a short letter and a short intent that this is what's most important to me, this is what where I'm coming from, this is what I have a fear about, or this is what I'd like more information on if this happens. And so you're taking that information and putting it into, a short document that is really, again, a really good communication tool. And just to remind everybody, thank you for being here with us and thank you for working with us on this. Here's a couple of things that would be important for you to know about me that that are not going to be on your checklist when you go through all the forms that they're not going to know. So, and they don't have time, they're not usually in your room. Your primary healthcare provider is not usually in your room very often through in your birth. Certainly in the case of a hospital and in most cases even that the primary healthcare provider has a lot of to-dos to do. That's the benefit of when we talked in one of our previous chats about having a doula is there's nothing clinical that we have to do. We can be 100% focused on you and your needs and what's important to you and what information you need at the time.
It's so true. I was surprised. I literally didn't see the doc until like the last, I want to say like 30 minutes. I'm like, I've been here for like 12 hours and I just met you for the first time. Like,
Yeah.
right before you're catching a baby. Before that, it's all nurses. The first, at least with the OB, the first OB birth, it was you and the nurses like the whole time.
Yeah. And Nikki, one of the things I hear all the time, and this isn't the topic for today, but it's really important, is I would really love to change the language around who delivered your baby. And
You did.
it
Got a
drives
pizza.
me crazy when I hear people say, well, who delivered your baby? And you give, you say whether it was the person at the other end. They
Yeah.
did not deliver your babies. Like you said, pizzas are delivered, babies are birthed, and you birthed your baby, whether that was a vaginal birth, whether that was a cesarean or belly or whatever you want to call it, birth. You are birthing your baby, and so yes, 100%, respect for those amazing people who catch babies, but you don't list only deliver pizzas.
Babies are not pizzas. Now we know the meaning of that phrase. I love it. It's true. So much truth to all of this. Ah, well, there you go. You heard it here. Birth plans. A little reframe on birth plans. Thank you, Lorri.
Reframe necessary. Thank you.